This is just like Professor Chris mentioned in UNAIDS and WHO, and it's a big, ambitious goal for ART and HIV prevention and control. And we trying to find the most of HIV patient and treat them and treatment successful. It's a model and indicate that if all of those targets was achieved by the 2020, AIDS could be eliminated and globally by 2030. That an achievement would create health care and economic benefit. It's the Chinese government and the Chinese HIV/AIDS physician and a nurse and the technician. It's worked so hard and to want to approach these ambitious targets. So, but for us, still a long road because the first the target is 90% diagnosis. And the Chinese expert and UNAIDS and WHO expert working together, they are estimated around 800,000 HIV and AIDS patients living. But we just find around 600,000 the patient. So also during the last 10 years, the HIV transmission road is changed a lot. From this slide, you can find the sex transmission is a major the reason of HIV infected, and not like the globally. Although the biosex and the commercial sex and infected HIV is the number one reason, but second reason is a man sex with man. And you can find it's a gay man population proportion is increasing very rapidly. So it's how to management and the sex transmission in China is the big challenge and big difficulty for us. So just like Dr. Patrick Lee introduced my team and work with the whole China HIV and AIDS doctors, and we initiated the National Free ART program from the 2002, and from 2003, and the government announced a very important HIV national policy we can call it's a full care and a full free and one care and a free HIV testing, and it's during the past 50 years, the Chinese government has tried to encourage all of the risk population and to do HIV testing. And the second is a free ART, and that means the Chinese government, central government, can provide the first line and second line and for the HIV treatment patient. The three is a free PMTCT for all of the HIV, the newborn infected baby. And and we also provide some social and economic support. So the China Free ART program is very special. It's a government program, and it's followed the National Free ART guideline. And in this guideline, we change a lot. Right now, it's a fourth. And it's CD4, the ART initial criteria from the CD4 lies 200 right now, and we want to treat every people if the HIV positive, whatever the CD4 higher and lower. Although we encourage all of the HIV and the positive people receive the ARV, but from this study and my team and the study result, we can find 2006, the ART initiating CD4 average just 106. After several years later, in 2009, and the initial ART average CD4 just 168. So, and other and data show, and the first HIV and AIDS diagnosis in China is around 30% patients are AIDS patients. So that means an HIV diagnosis rate is a big challenge for us. And in China, the central government can provide viral testing from the 2008. And the recent years, and we can find over 90% ART patients received viral testing one time per year. And just during the last 5 years, when we can, and the data show in those population and viral suppression successful rate is approach is 90%. So in actually is from ART, national ART beginning, and we try to treat every patient who were needed. So, and we to do a study, and we can find from the ART beginning to the recent year, the ART coverage is increasing every year. But and a different population is a different in the ART coverage. It's just like Professor Chris and a slide show, and the ideal population and the sex transmission group and a little bit lower compare the formal plasma donor patient. Also, an ART program is a big influence for HIV mortality. So, but still a gap from the ART patient mortality and the whole China HIV and AIDS patient society. And the main reason is the ideal population and the sex transmission and group population ART coverage is still lower. And the slides show every year we treat is the new HIV naive patient is more and more. And also we find the ART coverage is much higher, the mortality is lower. So also in the new study show, and if the 20 years Chinese AIDS patient receive the ART treatment, and if treatment successful, they will live much longer, and they have around 57 years and much longer it's living. But if treatment failure, and it's very short. So, I'm an ID physician. It's a talk with my colleague and my government many times. So treatment successful rate is more important compare the ART coverage. So although we want to treat all of the patients because in treatment for the patient is a very benefit and also can stop HIV transmission, but we also notice that the higher CD4 patient, for example, the CD4 over 500, even for discordant couples, and the ART coverage just 61%. So that means that higher CD4 patient, and some of those higher CD4 patients not ready for receive the ART treatment in China. We also notice it's very important things is a discontinued ART. So we just want to know what population what's the risk factors, and they did not continuing take ARV. So we also find if the patient initial the ART is CD4 is much higher, and those population significant higher discontinuing take the ART. So this is a recent study, and my team and with a lot of Chinese doctors, and we have the 3 group population. One is CD4 200 to 350. The second is 300 to 500. And the last group is CD4 over 500. And we select 3 indicators. And the first one is ART retention rate. And ART is a lifelong. It's continuing take the ART is a very, very crucial, important. So we find in the first year, and higher CD4 group and CD4 over 500 group is significant, is a higher discontinuing take the ART. That means the higher CD4 is lowest follow-up, and discontinuing is pretty higher, and compared to the lower CD4 group. But after second year, first year later, is no significant. The second indicator is a viral suppression rate, and also we find the higher CD4 group and the significant higher treatment failure compared to the lower CD4 group. And the second years later, a little bit different. The last indicator is a mortality, and the mortality through arms, no significant. And in all study, is a big difference with the START study. And the 2 years ago, and the New England Journal and published a START study, and they just 2 arms. One is a CD4 over 500, another is a delay, and 300 or 500. So, and we have the 3 arms. So this is a real world and data, not like it's a randomized clinical trial. But I'm a physician. I want to treat all of the patients, but we also notice if the patient feeling well, maybe it's not real feel, not really very well. So, and we need the more time to talk with the patient, to ask the patient, and to take ready to take the ART. So why a higher CD4 patient refuse earlier treatment, and for patient maybe lack of the education and understanding the benefit and risk, and the stigma, discrimination, and some patients don't want to take so many pills. And in the developed countries, the North America and the European countries, just 1 pill every day. But in all countries, 3 medication is separate. And I think in the CD4 higher patient feeling well is a big barrier for us. And so how to deal the treatment barrier. I think the education and guidance and the other social support and integrate the HIV program is very important. And this is globally an ART and a MAP. And it's 1987, the first ARV is developed by GSK. And the 1996, the cocktail, the ART available, and the 2006, and the single pill fixed dose treatment. And right now in developing country, it's an integrase inhibitor arrow. But in China, Let's see. And we just 7 ARV available, and the TDF, 3TC, efavirenz, lopinavir, ritonavir, and the AZT onarpin backup. So we have far way behind this new area. And so I want to talk another story about the PrEP. So I think we faced a big challenge is a gay man population, just like all data show, and it's man sex with man, and new report cases increasing very sharply in China. So this is a very special population. And we conduct a survey online in China. We want to know the gay man population and attitude towards the PrEP. So we want to identify some risk factors associated, and some people willing or refuse to start the PrEP. This study is all hospital and the US CDC Global AIDS Program and China CDC and internet APP. The name is BLUE-D. BLUE-D, when I first in time to contact BLUE-D, I was shocked. And this APP in the registration member is 27 million. Okay, it's a whole European country population. So it's the office is so big, and my office is small. It's just like this. So I really shocked by BLUE-D as so many, and the gay man population registration in this and the internet. And also small study is a very interesting result, and we find just 1 week, we collect over 4,500 information from each gay man population. We find all subjects is less 18 is 10%. The major population is 80 to 25. And it's over 54%. And for old population, it's a few. And we find in some gay man population were married is around 7.89%. And it's almost 70% consider themselves as the homosexual, and some 22.9% as a bisexual. So soon it's around 8% marriage and 22% bisexual. So it's more dangerous. And from this population to another social population. And it's a geographic and map. We find the Guangdong province is very close to Hong Kong, and the Shandong province, the economic situation is number 1 in China, and Beijing is a developing city. It's the capital of China. And Henan is a number 1 population in China, and Jiangsu, the economic situation is number 2, maybe number 3. Those are the top 5 regions where man sex with man currently living. So from this map you can find the gay man population living the good, the quality, the economic, and the city. And the China is mapping, and this survey cover 35 provinces. It's knowledge for prevention, and some given population is a regular screen HIV, and this proportion is 37.57%. And self-reported HIV negative is around 85, but pay attention for that population. And over 5.79% HIV positive already. So, and if the higher HIV positive population among the given population, and it's for future is very, very dangerous for those population. And willing to take the ARV, the Truvada, as a PrEP. And we find is most of the patient is 26% patient definitely want to take. And around 50% patient, maybe they considering use the PrEP. And compare the 5 years, another is a national level PrEP and survey. And this population willing take the PrEP is much higher, much higher. It's how to get the information about the PrEP. And is from the internet is number one. The second is a given population community. And the third is a channel is a given the population. From the medical, hospital, and the CDC is the last in the channel. So who is the candidate for PrEP in China? I think inconsistent condom use and STD, the sex transmission disease, the population is a high-risk population, and it's a multiple sexual partners, and the ideal population, and the alcohol, and the gay man population is a priority population for us. And are you ready? China is ready for PrEP, and right now the TDF FCC is available in China, but only for treatment, not approved for the PrEP. Over 4,000 ART clinic in China. That means we have a lot of HIV clinic, maybe in future, and they can provide the PrEP service for the gay man population. And we have treat and 500,000 and HIV and AIDS patient. That means we have a rich experience in how to manage and the ARV side effects and other medical service. Our treatment, national treatment program, the patient adherence is good. It's not like the American people, so it's a poor adherence. Maybe, sorry. So, and this is the last one is a conclusion. And the first thing, the main transmission route is a sex transmission, and especially the gay man population in China. The second, the earlier treatment, treat all is our target, is our ambitious goal. And treat all of the patient is a national policy, and policy we want to promote the ART and for every people and if they want. And but we also notice and patient with a higher CD4 count and maybe we need the more time to prepare ART before. And the ideal population is another risk ART treatment failure in a special population. And everybody knows the reason is ideal population is very, very special. And third thing is a PrEP in China. And I think it's an urgent need, and because the gay man population in China is so big population. It's a young and and poor economic situation and the stigma and the discrimination. So, and how to make a national pride and a plan or strategy is a big challenge for us. Right now, in the D10 hospital, working with the WHO, and we want to do the PrEP first. And the four things, and China has seen a little movement toward the PrEP, but still a lot of the barriers, the economic barriers and information barriers and the attitude and the knowledge and a lot of. So the last thing, for the PrEP, right now, US CDC recommendation is a Truvada, it's a 1 pill every day. So, but for the HIV negative population, still a big barrier for us. So, the last one is a milestone of China free ART. So, time is up, we want to, maybe in future, the next time I show you the PrEP and treatment in China. Thank you very much.